Broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, and welcome to Reproaction's Act and Learn webinar for the month of September 2021. We are so excited that you're here to join us for this month's topic, which is fatness and reproductive health. So first, I'll introduce myself. I'm your host. I'm Erin Matson. I use she, her pronouns. I am co-founder and executive director at Reproaction. I'm based in Washington, D.C., and I encourage you to follow me on Twitter at Erin2themax. I also want to acknowledge at the start of this webinar that all of this content has been put together by Natalie Newman on our team, who is currently unable to present today because she's out of the office. But I want to praise Natalie and directly honor and thank her for this incredible work that she's done to pull this webinar together and all of the content that you will see me present. So a look at our agenda, we'll introduce Reproaction, then discuss what is anti-fat bias. We'll talk about the intersection of anti-fat bias and reproductive health care, and I should say the many intersections of anti-fat bias and inadequate access to reproductive health care for all people. Then we'll go into our panel discussion. Very, very excited and honored to have Mae Friedman with us here today. Mae Friedman is a researcher on unstable identities and is co-editor of Thickening Fat, Fat Bodies, Intersectionality, and Social Justice. We'll talk about next steps, and then we'll go through Q&A. You're welcome to live tweet along with the webinar if that's your jam. Please just use the hashtag Reproaction so that we can find you and help retweet you and amplify you and your thoughts. And additionally, on Q&A, so those will all be, that will be moderated. Just put any questions, type them into the questions tab, and we'll get to as many of them as possible at the end. You do not have to wait until the end to put in your questions. So if you have questions at any point along the way, you can ask them, and then we'll dive into as many as possible with Mae at the end. Thank you. Okay, so a bit about Reproaction. Reproaction leads bold action to increase access to abortion and advance reproductive justice. We're deeply proud of our left flank analysis. We are known for our willingness to hold folks on all sides of the issues we work on accountable, whether they're traditionally considered allies or opposition. And we have a deep commitment to nonviolent direct action as one of the tools in our toolbox. So let's talk a little bit about what anti-fat bias is. Anti-fat bias in medicine is a public health concern, period. There are a number of different ways that anti-fat bias is perpetuated, and this is in no way an exhaustive list of examples. But first, let's talk about BMI, or what is known as body mass index, excuse me. So BMI has origins that are both racist and patriarchal. It was created as a tool by Adolf Quetelet, who was a sociologist, astronomy person, and a statistician, notably not a healthcare provider. And it was originally, the BMI index was originally intended to be used to find the mathematical mean of a population, which would presumably be the population's ideal. So just the idea that the mean or a mathematical figure would be the ideal. And it was called, in French, l'homme moyen, which consisted of data taken only from French and Scottish white men. So the BMI, first and foremost, is only based on white men. The BMI experienced a resurgence in its use in the 1970s, and it is now used to determine obesity and health risks, though it was never intended to be used this way when it was created. It was never intended to be used for an individual diagnosis. It was only meant to get the average of the population, and in specific, again, it was only based off of white men to begin with. So that's a piece about the BMI. Let's talk about racism. According to a book by Sabrina Strings called Fearing the Black Body, The Racial Origins of Fat Phobia, there was an Enlightenment era belief that fatness was an indicator of, quote, savagery, unquote, and racial inferiority. Anti-fatness and racism have always been entwined. And Sabrina Strings gave this quote that was really powerful during an interview with CBS. During the dawn of the slave trade, they, referring to white people, decided to re-articulate racial categories, adding new characteristics. And one of the things that the colonists believed was that Black people were inherently more sensuous, that people love sex and they love food. And so the idea was that Black people had more venereal diseases and that Black people were inherently obese because they lacked self-control. And of course, self-control and rationality after the Enlightenment were characteristics that were deemed integral to whiteness. Let's also talk a bit about religion. So in the 19th century, Anglo-Saxon Protestants took up the idea that to be morally upright and racially proper, you had to show a, quote, temperance, unquote, in the face of food, or restraint. And if you didn't show temperance, that was evidence of being a savage and unchristian. And again, I just want to say from a value statement, there is nothing wrong with food and eating food and our bodies. Our bodies need food in order to exist, and we should fuel them with pleasure, without shame, and get the nutrition that we need. And we are the foremost experts on what we need. I also want to talk a bit about diet culture. Diet culture is horrific, and it is all-encompassing in our culture, and it encourages an ongoing pursuit of thinness for thinness' sake. In particular, especially targeting women and girls. 97% of dieters do regain everything they lost and then some within 3 years, which is another way of saying that diets don't work. Diet culture or eating disorder culture suggests that being thin will make everything else fall into place. It equates thinness to health, which we know is not the same. In particular, in fact, studies, I was just reading a study that was being reported in the New York Times yesterday that was talking about how exercise is and physical fitness, the state of your body physically and its fitness is so much more important than weight to health. But additionally, there are other pernicious impacts to diet culture. There's a force that suggests that being thin is morally superior to being fat, and fat is positioned as unhealthy, lazy, a person is a failure, or lacks willpower or self-control, and that's all false. Diet culture values thinness, appearance, and shape above overall health and well-being, and disordered eating stems from anti-fat attitudes. And as a personal survivor of anorexia myself, I just want to say my strongest possible fuck you to diet culture. And then social media, let's talk about this. It's known that social media depictions of thin bodies and especially whiteness in particular causes physical, mental, and emotional harm. And in particular, youth and particularly girls are strongly affected by this. There's been explosive new reporting about Facebook and internal research that they have done and failed to act on, showing that Instagram made body image issues worse for 1 in 3 teen girls. And yet they have not made any changes. And we're trying to actually create an Instagram for kids. We know that on social media, some influencers and celebrities alter their appearance in film and pictures to fit a beauty standard, and don't disclose that when posting the image or video, making it appear as though the body they posted is achievable and realistic. So that's a bit about anti-fat bias. I'd like to move to how anti-fat bias impacts care specifically, and talk a bit about health disparities for fat people and barriers to care that are experienced. So institutional barriers can include avoiding seeking healthcare in fear of shame, judgment, and health concerns for not being taken seriously because of weight. And anti-fat bias plays a role in the failure to provide evidence-based healthcare for fat patients. Fat patients face intense medical discrimination and poor to no medical treatment, which contributes to poor health outcomes. And stigma about what weight can create considerable stress and anxiety for patients. For example, fat women are less likely to receive cervical cancer screenings and breast cancer screenings, according to research from the NIH. And fat stigma itself is a powerful driver of population health level disparities. And I really want to repeat that it is about stigma Stigma itself is driving health disparities and worse healthcare outcomes for people. Um, and so there a study that was done, or research that was done, on implicit association, so basically a tool that measures the strengths of associations between concepts and evaluations and stereotypes, found that even health professionals that specialized in obesity management had a pro-thin, anti-fat implicit bias. Again, that was research that's been referenced by NIH. Healthcare professionals often prescribe weight loss as a cure-all for a variety of different health problems, and this can contribute to the development of eating disorders. Once again, fuck you, eating disorders, and it ignores health concerns that have nothing to do with weight. And sometimes this is called opportunistic counseling, and it's done when physicians create opportunities to deliver preventive care and illness visits, even if the problem that the person sought treatment for is unrelated to their health. Another big piece where not having needs met in the doctor's office and anti-fat bias. You can look at it in a number of ways. It can be things as simple as chairs not fitting patients in the waiting room, to incorrect or small equipment such as blood pressure cuffs or patient gowns that are too small for the patients that need care. And then having or just the wrong equipment, period. And this, of course, all of these things work together to create a toxic cocktail that results in poor health outcomes. This means there are bad assumptions on the part of doctors and other medical professionals that are contributing to poor health outcomes and care. And just know that assumptions about health in regards to weight can be deadly. Again, it's much more about the strength of our bodies than the shape and size of our bodies. And a real life example of this is very tragic. So one elderly woman who was living in Canada died days after being diagnosed with cancer, after being told to lose weight to help with health problems over her years. Her diagnosis happened so late that treatment was not possible. And after seeking help for years, Ellen Maud Bennett was told that her weight was the root of her health problems due to bad stereotypes about fatness. I'd also like to talk a little bit about anti-fat bias and reproductive health care specifically, as Reproaction is an organization devoted to increasing access to abortion and advancing reproductive justice. And to be very clear, that reproductive justice is a human rights framework developed by Black women. It is the right to parent, the right not to parent, and the right to raise families in safe, healthy, and sustainable communities. Let's talk a little bit about that. So specifically, there are a variety of concerns with reproductive health care for fat people with capacity for pregnancy. One is that fat people seeking reproductive health care services are often denied services based on their weight, despite the fact that women with a BMI of over 30 generally don't have complicated pregnancies and have healthy babies. Reproductive health care for fat people with capacity for pregnancy, there are a variety of concerns, including fertility treatments that people may not have access to or be given access to on account of their size. Another piece is weight and pregnancy. Oftentimes people who are fat or people of larger size are told to lose weight prior to pregnancy or during pregnancy without taking a more holistic look at the nutrition that the pregnant person and their fetus needs. We also know that with Plan B or with emergency contraception, that emergency contraception, forms of emergency contraception can be less effective for people of larger size. And I want to be direct and say that that's not an issue with people of larger size. That's an issue. It goes back to this issue of who is put into studies and how are our medications formulated. Access to abortion can also be challenging due to anti-fat bias. Again, going back to things as simple as having the right equipment and gowns, and having adequate tables that patients can lie down on during procedural abortion. And then also I want to talk about fat parenting and hateful ideas in our society about who is fit to be a parent, with larger people often being targeted for with ideas that they don't know what's best and how to feed their children. So that's an overview, and I'm really excited now to introduce our speaker, Mae Friedman, who uses she, her pronouns. Mae's research looks at unstable identities, including bodies that do not conform to normative tropes of race, ethnicity, ability, size, beauty, and health. Most recently, much of Mae's research has focused on intersectional approaches to fat studies, considering the multiple and fluid experiences of both fat oppression and fat activism. Drawing on a range of arts-based methods, including digital storytelling, as well as analyses of treasured garments, and I have to just parenthetically say, how cool is that? Mae has explored meaning making and representation in relation to embodiment and experience. Mae, thank you so much for joining us.
My pleasure. Thank you so much for having me.
Yeah, so the pleasure is all mine, trust me. So my first question for you is if you could tell me about your work around anti-fat bias in health. What do you do and how did you get into this work?
Yeah, so I'm joining you here from Treaty 13 territory in Toronto in Canada. And I'm a faculty member in a school of social work. And I've been doing fat work for about a decade, partially because I was working in really progressive environments that are really attentive to anti-oppression in a lot of different manifestations, but where people were uniquely unaware or just not mindful of thinking about fat. And that just became increasingly problematic to me. And so I hadn't really intended to pivot my research focus to thinking about fat and fatness. But increasingly thinking about those intersections, I started to see the ways that we can't talk about anti-racism, we can't talk about sexism, we can't talk about colonialism without also attending to thinking about fat. As you mentioned, I use a lot of different methods, including arts-based methods in a lot of my work. And I think that the biggest thing I would say is in the decade of doing this, I'm stunned both by how silent we generally are in thinking about fat, the prevalence of sort of obesity epidemic and diet culture, and how much we're really not pointing to that as a significant site of sort of problematic discourse, and also on a personal level, how much this is impacting people's lives at every size. So when I give these talks, when I teach classes, I'm just stunned by who comes up to me afterward and how much of our bandwidth, individually and collectively, is spent on thinking about body modification, thinking about evading fat or outthinking fat in all of the things that we're doing. And it's hard for me, and I'm going to sound like a conspiracy theorist here, to not believe that on some level that's deliberate, that we are sidestepping revolution because we are preoccupied with our own bodies, and that's deliberate. It's a way to keep us from really pointing at what's wrong and seeking liberation by keeping us preoccupied with our own sense of shame.
I strongly agree with you, and I thank you for bringing that forward. Absolutely, 100%, 1,000% agree with what you just said. I do think it's intentional and that it's used as a tool to oppress people, and in particular keep them focused on themselves. Thank you for that. So. My next question for you, and it's also backed up by a question already. So folks are really interested to hear you just define what unstable identities means and what it means to you personally.
Mm-hmm. So when I think about unstable identities, on a broad level, I think about the foil to normative identities. So if we think back to the BMI and the ways that it was devised, and this idea of the neutral normative character who is of course always male, always white, always thin, always able-bodied and healthy, right? I think about the ways that we can test that in our instability. And in some ways, by that definition, we are, of course, all unstable bodies because none of us can really ever meet that ideal. We're all falling short somewhere. That said, so much of my orientation to thinking about unstable bodies comes from my own lived experience. So I'm both Arab and Jewish, which are perceived to be contradictory identities. I'm ambiguously racialized. I get claimed by everyone and anyone. And really, my race has been a subject of a lot of conversation in many different places over the course of my life. I'm a brown mom of white kids, and I'm a mother of four, but also an academic, which is also, perceived as antithetical. So on the one hand, I'm a feminist and an activist, and I know that the most effective activism has come from circumscribing identities. So thinking through, for example, the women's movement or gay rights or Black Lives Matter. And I'm really, I want to say right up front, committed to that politic. But on the other hand, I've always been mindful of what gets lost or harmed in that type policing of identity. So I've made my work very much about looking at the margins or blurry boundaries around race, gender, sexuality, appearance, nationality, and beyond. And without wanting to hollow out those movements, but instead to see movement-based identity politics as always a work in progress, a working truth, something that gathers us, but something with porous margins.
Thank you. Thank you so much for that. So I touched on very briefly the reproductive justice framework and how it includes the right to parent. As someone who's identified yourself as a parent of four children, so it's personal as well. Could you talk about that a little more? Who has the right to parent, right? Or who is seen as having the right to parent? Who is seen as being a good parent, and how so, and why? And again, that intersectional approach that you just outlined would be a perfect way to explore this question further.
Mm-hmm. I want to start by saying I think that the same politic that says that all bodies fall short also says that all parents fall short. And I think that that's equally rooted in capitalism and white supremacy, that there's a motivation to corporatize and consumerize appropriate living, but also very much appropriate parenting so that we buy more things so that we can somehow aspire toward an ever receding ideal. That said, I think we can't think about reproductive justice without thinking about all aspects of reproduction. So the right to choose not to parent, as well as the right to parent if and when we choose. And we need to acknowledge that that right is not offered equally. So as you touched on, at the point of conception, fat people, disabled people, many other people are not allowed access to assisted reproduction. Fat people are specifically told to lose weight before IVF, which is really troubling because in many cases, there are underlying conditions that might make folks both fat and infertile. And yet we're told that losing weight is going to be the point of entry to engagement with reproductive technologies. Once people become parents, fat kids, and especially fat Black kids, are taken into child protection settings more often. And fat parents are policed about their parenting choices, and their fat kids are shamed for eating and really just for existing across the board. So we know that even at really young ages, fat kids are picked last, are bullied, are reviled. There's really problematic research on who kids choose in looking at photo lineups of kids who are visibly non-normative, and fat kids are always picked last. I question the ethics of such research anyway, but I also want to share that. In terms of who's seen as a good parent, and I think it's really important that we don't lose the gendered dimensions of this, that really so often when we talk about parenthood, we're really talking about motherhood. And again, motherhood is a porous identity, not as rooted in biology, but acknowledging that there's discourses that are laid upon mothers specifically that are really problematic and super judgmental. So, mothers are always going to fall short. No one's good enough. And that said, in a neoliberal context in which children are products, any product that isn't normative enough, so thin enough, white enough, smart enough, healthy enough, is obviously evidence of maternal failure. So parents of kids who fall outside of these expectations are targeted as bad parents or bad mothers much more often than other people. So in the case of fat kids and fat parents, the endless scrutiny and surveillance of, even more so than for non-fat folks, is sort of endless. And as I say, in context with other intersections, that can result in more child welfare scrutiny, but can it also result in more, discussions with teachers, with doctors, with guidance counselors, and that's assuming kids who might be otherwise normative. So if you're dealing with kids with chronic health conditions or disabilities, those conversations might become amplified and inflated. And there's really a lot of tensions between those identities.
Thank you for that. Thank you so much for that. And I just, my mind was exploding multiple times while you were speaking, and just the fact that um, just the parallel and then the pernicious intersection of a mother never being considered good enough and a body never being considered good enough, that it's a constant source of attack upon people's identities and lives. Um, so my next question is, just if you could talk some more about the ways that fatness interacts with other identities. I know you've touched on that some, but if there's more that you'd like to share, I'd appreciate it.
Sure. As I mentioned before, I don't think we can talk about colonialism or anti-Black racism or transphobia or disableism without talking about fat. And I think that some of that is part of what I'm saying about this ever receding access to normativity, right? So we're meant to seek out health, wealth, and success. That is our imperative in a neoliberal capitalist white supremacist society. And so when we fall short of that, we're maligned and condemned. And so that only happens more within those intersections. So we use health as a stick to beat people with. We use the expectation of absolute self-control in all realms. And it's just a new way, I would argue, to perfect racism and violence, especially against Black and Indigenous bodies. In other intersections, fat trans folks are denied access to gender-affirming surgeries because of perceived BMI restrictions. Although what I hear from all sorts of trans people is that those restrictions fall away when other surgeries are offered. So the concern seems to have no actual rational merit. Fat disabled people may experience additional barriers to care. Fat women are specifically either hypersexualized or presumed to be sexually irrelevant. So a lot of different additive intersections of fat phobia, but I would argue the biggest piece is that, in fact, fat phobia, the focus on obesity epidemic, is just a repackaged racism and colonialism. And that's the biggest thing I'm finding in my work, that again, this increasing focus on self-reliance, it's not increasing, it's not new, but it is increasing. It's just gotten repackaged in a way that is using rubrics of health as a way of really maligning specific communities and specific bodies endlessly, but pivoting away from the kind of explicit racism. I mean, not to say that explicit racism isn't happening all the time, but it's not sanctioned socially in the same way, in the way that fat phobia and discourses of obesity absolutely have social sanction. And so we can use that as a lens for racism that somehow gets authority and is permitted in a different kind of way.
Mm-hmm. Do you see interactions, or do you see this as a one-to-one fit, what you were just saying on the way that health is used as a framework, even though it's not accurate, with wellness? That's another big trend right now, is wellness.
Yeah, so I'm uncomfortable. There's bad language for all of this, and I think that's we're using a colonizer's language to try to discuss liberation, so it's always going to fall short. But this idea that we are owed health, that we owe our health to the bigger society, I think is deeply problematic. It's a diminishing return, because heads up, we're all going to die, and we're all going to experience debility, even if we have the luxury and the privilege of sidestepping debility and disability at particular stages of our lives. That is always going to be a diminishing return. And so I think that really health has become this new morality, and I'm not the first person to say this, of course, that in the past you had to follow the rules because, in certain societies, the alternative is that you would go to hell. And everyone bought into that politic for a while because you wanted to avoid hell. And now for most of us, that's something we would roll our eyes at. But the idea that if you don't follow the rules, you will become sick or you will die, that's really rhetorically powerful. It's really rhetorically powerful. And so we are self-regulating every bite, every step, every movement, and it's only getting worse in this hyper-measured, where we have the technology to count our steps, to count our calories, to count our bites. It's only worse, right? Mm-hmm. I would argue this only gets worse when we bring in this lens of who will think of the children. Mm-hmm. I say this as a parent. The notion that something bad could happen to our kids is the primal fear. And so no matter how much research I do, the notion that I could be parenting in a way that would cause my children to suffer either through my own debility or through theirs, that's terrifying. That said, I see the ways that that's a whip hand that causes me to be obedient in ways that don't actually result in liberation for me or my children, that don't result in a livable life, right? And so I would argue, and I've said this in a lot of different places, that the race toward health is the opposite of liberation.
Mm. Thank you. Thank you. Um, Couple more questions, and then the questions are getting lit up. So it's great to see them come in. Please type more of your questions for Mae. We'll get to as many as possible. So I suspect I know your answer to this question, but would love to just ask it directly. Is fatness socially constructed? And if you believe that is so, what exactly does that mean to you?
Sure. Of course, fatness is socially constructed, right? Because it's a neutral body difference that we have ascribed endless social dimensions to, so that we believe that fat people are ugly, fat people are either hypersexual or asexual, we're lazy, we're dirty, we're stinky, we're gross, right? None of that, none of that is rooted in the biology of fatness. You know, having extra adipose tissue does not make you any of those things any more than making tall, being tall makes you smart. When I talk to children in particular, I use left-handedness as my example of a neutral body modifier that has come to have no meaningful social characteristics ascribed to it anymore, right? So I keep saying, like, in my ideal, alternate utopia, we get to a place where to say that somebody is fat and to say that they are left-handed are equally neutral. In the present moment, of course, that's not where we're at. And I always tell this story about how when my older kids were little, we would have this problem because in our house, fat is a reclaimed term, but that in the same way that they might comment and say, wow, that person's really tall, I had to teach them that they couldn't say, wow, that person's really fat, because it lands in a different way. So when I say that it's socially constructed, I don't mean that it doesn't have very real material consequences. Living in an environment that reviles you and that is actively putting trillions of dollars into wanting your body to disappear, that's not a neutral experience. Never mind the sort of inherent sizeism and being in places that literally don't fit, not being able to, get in a taxi or take public transportation or buy clothing or sit in an airplane, that there are, really tangible impacts to having a body that lives outside of normative space. That said, that is because of the choices that we have made, not because there's anything intrinsically problematic, different, or, particularly interesting about fatness. It's just another way a body can be.
Mm. Thank you. Thank you for that. So the last question that I have for you, and then I'll do a quick next steps, and then we'll go to Q&A from the audience. So as folks will recall, I got very excited reading Mae's bio, in particular on the intersection of art in Mae's activism and work. So how do you integrate art into your activism and work towards creating social change? And why do you think it's important to incorporate art in your work?
So I've been really lucky that in my research work, I've been able to use art-based methods in a lot of different ways. And I would argue that there are, I talked a little bit about the limitations of language, that there are things that we can convey about the human experience that language just completely falls short of. So I've used digital storytelling in a lot of the different work that I do. Digital stories are micro documentaries, usually between 2 and 5 minutes long, in which filmmakers get to describe their own experience however they want around particular themes or cues, and then populate those narratives with visual and auditory materials to make just like tiny little documentaries. And I use them in my class a lot. I always tell this story about how I had one like really buff young man come up to me. I showed a story about somebody's lived experience of fatness that was so raw and so emotional and effective. And this young man came up to me and he just said, I need to call my mother. I didn't understand until now, but I need to call my mother. My mother is a big person and I have to go now. And I just think I could assign 1,000 scholarly readings and never connect with somebody the way that some of the arts-based materials that I've used have connected with somebody. There are things about how we live and exist that art lets us access that I just don't know that we can get at any other way. Um, and I will say, I wrap that also in a healthy skepticism of data. So, you can't do fat work without becoming really skilled at filleting down scholarly studies and to understand some of their limitations. What are the methodological problems with traditional scientific studies? What's going on with the research? Because you have to be able to speak back to that if you're going to talk about fat people. This presumption that we're all going to die, the data doesn't hold that up, actually, if you really dig into it. So, on the one hand, I've become really skilled at engaging with traditional data. And on the other hand, I'm increasingly feeling like because all data is subjective, because all data is problematic, has confirmation biases, I would rather step outside of any of authoritative lens and use something like art, like music, like a video, like film, to allow us to describe and engage rather than measure and dissect.
Mm, that's beautiful. Thank you, Mae. Thank you so, so much. All right, I'm going to go on to a few housekeeping items, and then we'll get into the questions that are coming in from the audience. So first, just an encouragement to folks on this webinar to plug into Reproaction's campaigns. You may have heard there's quite a bit going on right now for people who are concerned about access to reproductive health care and services. Please sign up for email alerts at www.reproaction.org and you won't miss a thing. We encourage you to interact with us on social media. We're Reproaction on Facebook, Twitter, and Instagram. And please save the date for our next Act and Learn webinar. We hold these webinars every single month, so you want to sign up for our email list. That way you'll never miss an invitation. We want you to come. Our next webinar will be on Tuesday, October 26th at 1 p.m. Eastern, and we'll talk about abortion coming to the Supreme Court, what's coming, and what's at stake. So we hope you'll join us for that very important webinar as well. And with that, we'll move to Q&A. One thing I want to open with at the outset, there were some questions about slides. We will be sending out a recording of this webinar to all attendees, and thank you so much for your interest in continuing to engage. So first question that we have is, how many medical schools actually teach health at every size? And what movements are in place to make it part of programs universally?
Oof. I don't know that I know any medical schools that teach health at every size. I think that okay, so BMI is a terrible measure, but even using that terrible measure, the fact that 2/3 of the population in the US and Canada fall into either the overweight or obese categories. So we comprise the majority of bodies. And I think there's one lecture on eating disorders in most medical schools. I've been asked to speak to particular medical school classes, usually, to the Justice Club, which is to say I'm really preaching to the converted already. I also want to say, at least where I live, medical schools still have an interview for entry. And so when I go talk to med students, I am struck by them being the thinnest and most conventionally attractive groups of people. Even if they're diverse across a lot of other different axes, they are often conventionally attractive, thinner people. And I think about who has the chutzpah to apply for medical school in a bigger body. So in some ways, we also have this kind of self-perpetuating truth where the knowledge makers in these contexts are usually drawn from people who may not who definitely are informed by fatness in their own lived experiences, but might not have the specific experiences of fat phobia and weight stigma that a bigger body might have. I think it is appalling, and I would argue it's malpractice to not be thinking about how to thoughtfully engage with bigger bodies. And so many of the negative health outcomes that are associated with fatness could be explained away by that lack of care right at the point of entry.
Thank you. Next up is a question from Allie, who notes that fat liberation activists consider the word obesity to be a dehumanizing slur and an illegitimate diagnosis. And Allie would like to hear you speak just to the use of the word obesity, period.
Mm-hmm. So I really dislike those O words, obesity and overweight. I think that they presume that there are specific health outcomes or specific characteristics at specific, lines of weight. And I just think that that is not in any way borne out by any lived experience, by any actual research, right? Obesity is, a multi-intersected identity, right? So people who fall into that category have infinite different kinds of health experiences, lived experiences. And so it's not a useful descriptor. And the fact that as a descriptor, it's been used to enact so much violence and again, to sidestep so much responsibility for the social determinants of health. I think sometimes if we took all of the emotional resources and also financial resources that we have put into contesting the obesity epidemic, so literally trying to make some of us disappear, right? Trying to convert some of us to different bodies. If we had put that into actually trying to combat poverty, trying to increase choice, trying to enhance, to end homelessness, to increase the livability of our communities, maybe then we would actually be working in a direction toward health. But instead, we've just created what, lots of folks call an obesity witch hunt. And I think it says a lot about what we actually value, that this is about aesthetics, obedience, and normativity. It's not actually about wellness or health.
Mm. Mm. Thank you. And there's a related question from Paula that says, what actual words can I use with my super skinny, fat phobic doctor? Again, going back to the inadequacy of language and knowing that not everyone may be in a position to make art. What are better words to use in those situations?
Really good question. I think that using fat to describe ourselves can really make people flinch, but I think that that's its own form of activism sometimes. I shirk, I'm just not interested in any of the euphemisms. I'm not plus size, I'm not cushy, I'm not bubbly. Like, please, I'm a fat person and I want to take the sting out of those words. That said, what I often say to my students or when I give public talks is that sometimes it can be useful to sidestep the interaction. So I might go in and say, well, actually, I research fat people when they ask what I do, or I might just say, it was so interesting. I went to this webinar recently. We were talking about weight stigma in healthcare settings. And so you're not necessarily accusing your individual practitioner, because that can make folks really defensive and unfortunately can result in poorer care. But that we are putting them on notice that we're not willing to show up and be treated in a, disrespectful, disciplinary way.
Thank you. So here's a question more directed toward reproductive health. So this is a question around advocacy, and the questioner says they work in an agency that provides training for reproductive health professionals. They always make a point in their classes to address the intersecting issues of fatness and reproductive health. But unsurprisingly, they've seen their colleagues say incredibly harmful things, from things like all forms of birth control are less risky for pregnancy than pregnancy for obese women, to things like people who gain weight on Depo-Provera shots are just bad at self-control. The questioner tries to call people out when they say these things, but also feels like they're the only person bringing up these issues. And as a fat person, thinks that their concerns are often dismissed as just their own personal vendetta. So any additional suggestions? You just made a great one about referencing a webinar. Do you have anything else you'd like to say, suggestions for how to advocate when you often feel like you're not supported? And just also want to editorialize and thank you to the questioner who says thank you so much, and saying that they so appreciate this webinar.
That's so nice. I want to say first and foremost, I'm so sorry to hear that that's happening, and it is just absolutely not okay that that's occurring to you, near you, over and over again. I think the extent to which I'm not interested in hierarchizing oppressions, right? But the extent to which there really is still social sanction to say terrible things about fat people in a way that we just would never, certainly not in our professional lives, that we would never say about any other underrepresented or marginalized identity, it's just outrageous to me. And so I think, and it's also hard when you're the only one, right? Sometimes I think, sneaking in some articles or, various different information and just leaving it in places that are public in the hopes that people will read along, bringing in other expert knowledge. Again, I really reject the notion of expertise, but unfortunately, particularly in medical settings, that's what gets people attention. And so being able to continually speak back to the idea that weight stigma contributes to bad health outcomes. That said, it is just amazing to me how much people really will come to the conclusions that they want to come to. And I think I want to say as well, at my best, I try to offer compassion here and think about who is benefiting from the crappy things that they're saying. So who has to believe that their own fight with their own body, their own, racing toward thinness, and all of the actions that they have to take to maintain thinness are just, right? And so I think that that's also what is motivating it some of the time, is that you've got a whole bunch of really hungry, thin people who have to believe that the way that they're behaving is in aid of something. And that when we say like it's actually bullshit, there's a real cost to people in hearing that. And so I'm going to say, unpacking it a little bit and wondering what is motivating the question, bringing in as many different, infallible experts as you can. And I'm happy to provide sources if that's useful. You're welcome to share my email address with anybody who needs it. But I also want to say it's a very countercultural knowledge. And even with all of the social sanction I've been given to talk about this as a scholar, as an academic, as a published person, I still kind of show up with my Teflon shield in a lot of places, feeling a bit terrified that I'm going to be stripped bare and taken to task and yelled at. And so I'm sending a lot of love toward you is what I'm trying to say.
Thank you. And uh, Mae, I just want you to know how much love is pouring in on the questions tab, with people expressing gratitude and appreciation and feeling seen today. So really, thank you. Thank you so much for speaking with people today. So this is an interesting question also on reproduction, repro issues. So do you have any recommendations for resources for fat people during pregnancy or who are seeking to become pregnant? In particular, the questioner references that a fear around pregnancy is being condescended to and facing discrimination by medical professionals for being fat during a pregnancy if they were to pursue one. So any books, articles, techniques, or anything that you could recommend, they're eager to hear.
So there are a couple of plus size pregnancy books that I know folks with a huge grain of salt, because they're still really, really rooted in the medical model, at least take for granted a bigger body as the starting point, as opposed to being a footnote in all of the other expert discourses. That said, it's still, as I say, really rooted in a presumption of sort of fatness as pathology that I think we want to take care with. I know that there are, and I'm a little bit, my youngest is 6 now, so I haven't gone through a fat pregnancy in a little while, but I think there is increasing traction on social media of fat pregnancy groups, fat, reproductive care groups, trying to conceive groups for fatter people. And there can be a lot of solace and a lot of connection in those places. I will say, both personally and professionally, and I know it's different in the States than it is in Canada where I live, but midwifery care was a game changer. At least in my practices, I did not have to be weighed if I didn't want to. It was really clear-sighted about the presence of weight stigma and how much the changing body of a pregnant person can also be a real trigger. And there was a lot of really thoughtful, careful attention given to that in my care. And so I can't say enough, if you have the luxury of midwifery care, and I know that's not accessible to everybody in terms of insurance and finances, but also in terms of underlying other health conditions. But if you are able to go that route, I can't recommend it highly enough.
Thank you. And I'm going to take a moment and just read straight here on the webinar, because the sense of community that's happening on this webinar, and Mae, the guidance that you're providing and the knowledge that you're dropping and the love that you're putting out into the world, I just want you to hear what's happening. People are typing in, thank you so much. I'm literally tearing up. Just having that validation and love and support is incredible. Another person just wrote in, I really needed this today after a terrible doctor's appointment last Thursday, where literally everything from a form of fat shaming and stigma, even after I disclosed a past eating disorder, I'd hoped to get help for my back pain and put it off because I expected it, so I wasn't surprised. It's just really wonderful to hear this after that experience. And I also want to say that even I am tearing up, and other people are saying, I feel so seen and heard. I've struggled with eating disorders, and this was so validating to hear. I needed this. So I really want to underscore how much love is coming in and feeling and holding this community that's happening right now in this virtual setting, even on this webinar. And thank you so much to Mae. There's more coming in, and I do have real questions. I just think it's really important to share this as well. Another person writing in, as a fat woman considering pregnancy, I love feeling more informed and empowered to navigate the systems. As someone recovering from an eating disorder, and as somebody who did recover from an eating disorder, my fist in the air to all of you who are doing that work. And so and even just to the point of community, a rhetorical question, anyone else feel that they need to be reprogrammed? I mean, just incredible. So I've got a question I'm going to ask. I know the question I want to end on. I'm very excited, but this one here, Mae. So are there concrete steps that folks can take as individuals and groups to help others decouple the idea of fatness and unhealthiness when people just so deeply believe that fatness is always unhealthy, and we know that is not true?
Mm-hmm. I mean, throw out the scale. I can't say it enough. And I want to say, this is really important. I say it all the time in my class. I'm teaching an elective on fat studies, which is amazing because it means I have 12 weeks to chat with undergraduates about fat stuff. And it's such a gorgeous place to be. That said, this is the most countercultural thing we could be believing right now. This idea that it is not our obligation to achieve health, and that fatness and health are not related. And so all of us are going to be in different places with that journey. And I want to make it really clear that I don't want the takeaway today to be that now you're going to feel guilty about having a scale or going to eat a salad or going for a run or whatever it is that you're doing, because this is a real work in progress, and it's incredibly, incredibly hard work. So to just be gentle with yourself wherever you are in your journey at really starting to think toward fat liberation and undermining that kind of weight stigma discourse that is so all pervasive in everything that we do. So that said, I think that becoming a critical researcher has been really useful to me in terms of unpacking some of it, really understanding the endless headlines. If you actually click through to the articles that these headlines are based on, sometimes even just by looking at the abstract, and I'm not saying like you don't have to have a PhD in biochemistry to get it, but if you look at the conclusions, there's often hidden information about the fact that, for example, people in the overweight category live the longest, or that many different health conditions, that having a bigger body can be really protective against a lot of other different kind of health conditions. So I think some of it can be that, but some of it is also understanding this as a tool for liberation to which we are entitled the way we are in other parts of our lives, that some of the shit that we don't put up with in respect to racism or sexism or transphobia or disability, that we do not allow ourselves to eat shame. And I will say, I think this is where parenting for me has been a really healing journey, because if I love my children's bodies in every permutation as much as I do, I can't possibly think of my own body as flawed or disgusting in the way that I have been taught to be. And so that for me has been a big part of my process as well.
Thank you. Okay, a couple more comments and love that's coming in, and then I have a final question. So we've got one person who wrote in, look for a HAES doctor like me, call the office ahead of your visit to see if you have to be weighed, and ask what their BMI cutoffs for fertility treatments are before you go. The same person also came in and said, if there are other providers on here who are interested in becoming more cognizant of those principles, HAES, Harvard has a webinar recording on their website. And another person says they're really grateful to be here today. They're becoming a doula because they want to support other fat people, and especially fat Black people, through pregnancy and parenting. Thank you. A recommendation for the podcast maintenance phase that talks a lot about these concepts and has been really personally helpful for someone. Another person just writing in, okay, and now I'm crying. Thank you so much. I didn't know how much I needed this whole thing, or how much I needed to hear someone say specifically that it's not my obligation to achieve health. Mae, this has been fantastic. Thank you so much. Last question for you, and I know you'll love this as a last question. How do we stop ourselves from sidestepping revolution through fat phobia?
Oof. Oh, I'm sure it's easy. Listen, I think there's no liberation for any of us unless there's liberation for all of us. All of these fights, they're all interconnected. It's a fight for everything, right? So when I see, for example, people talking about food justice by talking about how we need healthier food because we're all getting fat, that's not justice in my view, right? So I think the same kind of love and care that we believe that people deserve around a lot of other different fights, we have to believe that there's a worthiness here. This gets wrapped up in this idea that fatness is something people choose, that, if you don't want to be treated like shit, just eat less. But that's nonsense, and that has nothing to do with anything. So I think if we actually believe that, all bodies are worthy bodies, if we believe that we deserve, the love that each of us can offer to the people we love most, then we can start to work toward liberation in a really substantive way. But it has to include an acknowledgement that bodies come in all shapes and sizes, which we know to be true, but we don't see reflected in the bigger politic around us.
Thank you so much, Mae. This has been a magical hour, and based on seeing these comments come in, I think I need to go hang up and just cry tears of joy at this webinar. So thank you so much. Thank you so, so much, truly, from the bottom of my heart. Thank you for the gifts that you have shared with so many listeners today. I know you've made a powerful difference. So we will be sending out a recording of this webinar. Is there anything else you'd like to share before we close?
Just how much this means to me. I don't always recognize that what I'm doing is particularly important, and it can feel like I'm doing something that feels kind of indulgent because I'm not immune to that messaging around fatness either, right? So thank you for providing such a supportive, amazing space. And I just want to say, I'm sending love to each and every one of you. And I really welcome further connection. So please feel free to connect with me beyond this if that's of any use.
Thank you. Thank you so much. Have a wonderful rest of your day. Bye.
Bye.